Think your hips might be more flexible than usual? Here's how to recognize hypermobility and the 3 easy to do daily awareness that will make a difference. Hypermobility in the hips can be clicking when you move your body and when you move your legs. So it just clicks without you realizing or doing anything about it. You can have pain in the hips when you get up without any really history. There's no incident, but your hips or hip hurt. And you can see osteoarthritis on your x-ray, but then you're not old. I see x-rays all the time when the person is actually young, but there is that degeneration that's taking place. This is just, you can have hypermobility in a joint that does not necessarily make you hypermobile. Also, that's something to keep in mind. So just because you have extra loosiness in the hips does not make you hypermobile. But hypermobile or not, if you have unstable hip joints, these are the awarenesses that I want you to keep in mind. When stand on both feet, go ahead and stand up on both feet and pay attention to the bottom of your feet. Are you shifting your weight more on one side or the other side? All of these are little things that can actually push you in the wrong neighborhood of presence and cause instability in the hips. Are you putting more weight on one side than the other side? Are you, in other words, putting equal amounts of weight on both feet? That's very important. Do you stand more on one leg than the other one? That's a lot of people do that. When you're standing, is your pelvis in front of your ankles? So I'm going to go over here. This is the ball of your hip joint, and this is the bump on the outside of your ankles. Place your hands on the balls here, not on your waist, but on the balls. And then see when you're standing, are you in front of your ankles or not? That is so, so important. Do you lock your knees? Because that will encourage that locking of your knees to try to limit how far this is going forward. It's almost like your knees are trying to pull you back. That is so, so important. So you don't want to be locking your knees. You don't want to be in front of your ankles. You don't want to be standing on one leg or not having equal amount of weight on both sides. Don't do things that make you feel like, oh, I'm getting such a relief in my hips. So people sit with a split, like they split their legs apart, and that's where they get the relief. Or I've seen people sitting with one leg, one foot under them, and then the other one really stretched out and away. So I can't show you how they sit because I don't have that. But those of you who are watching and you do this, you know what I'm talking about. So don't do the things that take you to that extreme range of motion, because then you're actually making a ligament or ligaments to be looser than they actually are. You're not making headways, and that's a problem. So we don't want to be dealing with that. I hope that this helped. If you are hypermobile and you need help understanding what your tendencies are, what to replace them with so you can stabilize your joints, use one of the methods of contact to contact me. And until next time, take care.